your emergency?
I think I need an ambulance.
Yes, sir. What's happening?
I have chest pains and shortness of breath.
When did your symptoms start?
It's just about 15-20 minutes ago.
All right. Stand by while I dispatch the ambulance.
Each year, hundreds of thousands of Americans have the most serious type of heart attack, known as an ST-elevated myocardial infarction, or STEMI, in which blood flow is completely blocked to a portion of the heart. Unless this blockage is eliminated quickly, the patient's health and life are at serious risk. Currently, around 2/3 of STEMI patients fail to receive the best available treatments to restore blood flow. Mission Lifeline seeks to save lives by closing the gaps that separate STEMI patients from timely access to appropriate treatments. Although Mission Lifeline is focused on improving the system of care for patients who suffer from a STEMI each year, improving that system will ultimately improve care for all heart attack patients. According to statistics provided by the Iowa Department of Public Health, cardiovascular diseases, including stroke, are the leading cause of death in Iowa. Heart attack and other ischemic heart disease is affecting approximately 90,000 Iowans right now. The overarching goal of Mission Lifeline STEMI is to reduce morbidity and mortality for STEMI and out-of-hospital cardiac arrest patients. We will improve their overall quality of care by performing pre-hospital 12-lead EKGs, transmitting them to the hospital, following statewide guidelines, and providing education and data collection. Each piece of the system has a common goal: get the patient emergency medical attention immediately and move the patient to a primary PCI center. In this video, EMS is the focus piece of the system of care. EMS will be first medical contact, which, again, is the first trained healthcare provider able to assess and identify the signs and symptoms of a cardiac problem and start the system rolling. PCI goals are door to ECG in under 10 minutes and first medical contact to PCI in under 90 minutes. There are regions that this is not always possible, and EMS must stop at the non-PCI hospital. The patient then needs to be screened for potential thrombolytic therapy. Therefore, you need to work closely with your local hospitals to decide the best scenario for transport of the patient to the PCI center. The system of care begins with the patient identifying signs and symptoms of a possible heart attack. Ideally, that person or someone with that person would call 911 and enter the emergency care system in that way. However, nationwide, our data shows that the majority of heart attack victims, especially in rural areas, drive themselves to the hospital. This happens for many reasons: denial, embarrassment, thinking they can get there faster than if they waited for an ambulance, or not wanting to bother people. What we as healthcare providers try to help people understand is that they actually get to definitive treatment safer and faster by almost 30 minutes if they enter the system via EMS, and they receive emergency treatment that can buy their heart muscle precious time while being transported to the PCI center or cath lab hospital.
Did your pain go anywhere?
Centralized on my chest and my neck.
How about into your arms?
A little bit.
Okay. Are you short of breath?
Yeah.
Okay. Are you nauseated or have you vomited?
It's a little bit nauseated.
Okay.
I'm going to put 4 baby aspirin in your mouth. I want you to chew them up, okay?
The next part is EMS. EMS ideally has the ability to perform a 12-lead ECG and either transmit it to a provider for interpretation or interpret it themselves, triggering the STEMI alert.
Our ETA is going to be about 7 minutes. Anything else I can tell you? Okay, we'll see you about 7. Thanks. Bye. Sir, the next thing we're going to do here after, since I'm off the phone, we're going to get you in a gown. And that is so we can get into the cath lab quicker. A lot of that stuff is just making sure that we get you in there as quick as we can. Okay?
Okay. You really don't need to do this. I could have driven myself in.
Oh, so look how much stuff we've done for you, even getting there faster. It's like driving here is not a good idea. And think about this, what happens if something happened when you're driving? Then you're in worse shape than you were, because then you have a car accident on top of it. But we're doing things now that is going to save time and save your muscle, and it's going to help your heart. Okay? That was the right move.
Okay, we'll see you when you get here. Thank you. Dr. Val, we've got a 42-year-old male coming in with chest pain. Got an EKG for you. Dr. Val, here's that EKG I told you about.
It's a STEMI. Go ahead and call a cardiac alert.
Okay, thank you. Go ahead and initiate the cardiac alert, please.
EMS is also capable of transporting the patient safer and quicker than if they drove themselves. And most importantly, EMS can begin emergency treatment, saving cardiac muscle and providing resuscitation efforts if a patient should cardiac arrest.
Hi there.
Hey. Hi, sir. How are you?
Been better.
Yeah, what's your pain like right now?
Feels like someone's sitting on my chest. About
Okay.
8.
Okay. Well, we've got the cath lab ready. They're gonna get you in there and get that pain taken care of, okay?
Whether BLS or ALS, you have the skills to acquire 12-lead ECG. It should not delay scene time, but it puts the entire system of care into action. Once the STEMI is identified, the decision on how to get the patient to the PCI hospital must be made. Are you going to the closest hospital, or are you going straight to the PCI hospital? Will you tier with ALS transport or a helicopter? Dispatch centers play a key role in working with the person calling 911 for help, and are always striving for the best outcomes for each patient by partnering with EMS and the hospitals to overcome challenges in the system. The other pieces of the system are the non-PCI hospitals and PCI centers. Each have the goal of limiting time from first medical contact to device by limiting door-in, door-out times in the non-PCI hospital. Another common goal is to overlap transport services from rural areas, provide fibrinolytic therapy or clot-busting drugs to qualified patients that cannot get to PCI in less than 120 minutes, ultimately striving to get patients from first medical contact to device in less than 120 minutes when geographically possible. Interventional cardiologists from across the state of Iowa, working with Mission Lifeline, have developed a statewide guideline to assist non-PCI hospitals in the care and priorities of the STEMI patient. That guideline recommends a first medical contact to 12-lead ECG time of less than 10 minutes. STEMI heart attacks are at high risk for cardiac arrest. EMS can start resuscitation immediately, so we never want a patient to drive themselves to the hospital. Next is a door-in to door-out goal of less than 30 minutes. When EMS recognizes a STEMI in the field, the referral hospital can have ALS or air transport on the way before EMS arrives, shortening the time the patient is at the referral hospital. This section lists patient care that can be completed, but only if time allows. Do not delay transport. There is a pathway for the patient that cannot get from first medical contact to primary PCI in under 120 minutes. That pathway includes the screening and administration of fibrinolytics. EMS, the referral hospital, and PCI hospital must collaborate to gain a better understanding of their responsibilities and role in the STEMI system of care. The PCI centers in Iowa are collecting large amounts of data that span the entire system of care. This will enable hospitals to benchmark across the state. The Mission Lifeline task force and committees will allow for networking and the sharing of best practices across our state. It will be possible to watch the trends across Iowa to see the improvements we make. This data will also provide significant information that helps drive the science behind the guidelines that are also continually being updated and strengthened. Mission Lifeline goals: save lives, improve outcomes, and restore health. Thank you for joining us today. You will find this video a good resource for your team.